Now, the floor of the oral cavity consists of many structures. They are including the muscular diaphragm, and this muscular diaphragm composed by two adjacent mylohyoid muscles forming a muscular sheet as a diaphragm separate the oral cavity from the neck from outside. So it provides a support for the floor of the mouth. Most of structures rest on this diaphragm, on this mylohyoid sheet of muscle. The geniohyoid muscles, from its name, attach to the genial tubercle of the mandible here and passing to the hyoid bone just posterior and inferior. They are ribbon-like structures, two adjacent muscle called geniohyoid muscles, and they act as suprahyoid muscle pulling the larynx forward during the mechanism of swallowing. And the tongue itself is one of the contents of the floor of the mouth, and it is a muscle. It is a mass of muscle, and this tongue is connected to the floor of the tongue by what is called the frenulum, and the frenulum is a fold, a mucosal fold containing connective tissue elements that attaching the tongue to the floor of the mouth. And the other structures present in the floor of the mouth is the salivary glands and their ducts, like the sublingual gland and even the deep portion of the submandibular gland right here. This is the sublingual gland, the yellow one, evident here beneath the tongue from its name, and the portion of the submandibular salivary glands. These are also contents of the floor of the oral cavity. Okay. Now the cheeks as a lateral boundary of the oral cavity, they are formed by the buccinator muscle, which is lined internally, the cheeks, by the oral mucosa. So the cheeks, its main substance is a muscle, buccinator muscle, and medially or internally it is formed by or lined by the oral mucosa, and this muscle buccinator is contracted to keep during mastication and during mechanism of digestion, oral digestion of the food, contracts to keep the vestibule empty from fluid, to prevent lodgement of food particles within the vestibular space outside the teeth. So it is very important action of the buccinator. This buccinator muscle is actually supplied by facial nerves. So the buccinator is one of the muscles of facial expression, although it is used in the mechanism of digestion of the food in the oral cavity. Now the tongue, as an extraordinary boneless does not attach to the boneless mass of muscles, and this organ very vital and very important and very functional for many functions. For example, you can protrude the tongue, we can fold the tongue, and we can invert it, and also we can make it flat or even expand it to fill the mouth cavity. The tongue, as a definition, is a mass of muscles and composed of two groups of muscles, actually, the intrinsic group of muscles and the extrinsic. Starting with the intrinsic muscles of the tongue, they are four paired intrinsic group of muscles on each side, and they are named according to the direction of their lie. For example, we have superior longitudinal or inferior longitudinal, or even we have a transverse and vertical muscle fibers of the tongue. Now these muscles affecting during their contraction, affecting the shape and the size and the volume of the tongue, while the extrinsic muscles, including the following four muscles, starting with the genioglossus muscle, the yellow one, attached to the genial tubercle of the mandible, and then to the hyoid bone. And this muscle has its function to protrude the tongue by the inferior fibers, or depress the tongue, pulling it down by the middle fibers, and even draw the tip of the tongue back and down in this direction by the superior fibers. So this genioglossus muscle, the inferior fibers make the tongue protruded, while the middle fibers depress the tongue, and the superior fibers here pulling the tongue backward and downward. Now the second muscle of the extrinsic group is the hyoglossus muscle. The hyoglossus muscle, it is in the green colored here in the picture, and attached to the hyoid bone from its name, and also inserted into the substance of the tongue. The function of this hyoglossus muscle is to depress or and even retract the tongue, depress and retract the tongue. The other muscle is the styloglossus muscle, and here we can see it in a purple color as seen here in the picture, and it is attached to the styloid process from one side and to the side of the tongue to the other side. So two attachments from its name, stylo and glossus. So it is attached to the styloid process of the temporal lobe and the side of the tongue. The function of the styloglossus muscle, retracting and even elevating the tongues during its function. The palatoglossus muscle, and this muscle attached to the palatine aponeurosis and also inserted into the tongue, and actually this muscle is enclosed by or covered by mucosa and forming a fold called palatoglossal fold, which is the same as we mentioned it just before, the anterior pillar of the tonsillar bed forming boundary of oropharyngeal isthmus. And when we dissect the mucosa, we found a muscle fibers inside, which is the itself the palatoglossus muscle itself. So this is the palatoglossus and palatoglossal fold, and here we have an important note that all the intrinsic muscle of the tongue is supplied by hypoglossal nerve as a motor supply, and also all the extrinsic muscle except the palatoglossus muscle, these muscles supplied by hypoglossal nerve, the 12th cranial nerve motor, and this exception, the palatoglossus muscle, is innervated by the vagal nerve or the vagus nerve, which is the 10th cranial nerve. So we can say that all muscles of the tongue, whether extrinsic or intrinsic, they are supplied by hypoglossal nerve except one, which is the palatoglossus, supplied by vagus nerve. The innervation of the oral cavity is important, and here we can state that we have two types of innervation. We have general innervation and special innervation regarding the sensory innervation of the oral cavity. To start with the mucosa of the oral cavity, it is supplied sensorily by branches of a trigeminal nerve. When we have the hard palate, mucosa is innervated by the greater palatine nerve and the nasopalatine nerves. They are supplying the mucosa of the covering the hard palate by these nerves, and the soft palate is innervated by the lesser palatine nerve as sensory supply. the floor of the oral cavity or the mouth receives its nerve supply, the sensory nerve supply, from the lingual nerve, which is a branch of the mandibular, which is a division of, or third division of, the trigeminal nerve. Now the cheeks, as a sensory nerve supply, they are innervated by the buccal branch, which is a branch of mandibular. At the same time, it is sensory and it is motor to the buccinator muscle. Sorry, it is sensory by trigeminal, and the buccal branch of facial nerve, it is motor to the buccinator muscle. So we have two named buccal nerves. We have a sensory nerve from the trigeminal, and we have a buccal branch, a motor branch from the facial nerve supplying the buccinator muscle as a motor supply. Now the tongue has its special innervation. Actually, it has general sensation and it has a special sensation. The general, it means the touch of the tongue sensation. We have the anterior two division of a tongue into anterior two division, or 2/3, and posterior 1/3. So the anterior 2/3 of the tongue is supplied generally by the branches of the trigeminal nerve, and more specifically the lingual nerve. The lingual nerve is a sensory for the anterior 2/3 of the tongue, while the special sensation, which means the taste sensation of the anterior 2/3 of the tongue, is by the facial nerve, via what is called the chordate branch, which carries the special sensation for the tongue, or the anterior 2/3 of the tongue, while the posterior 1/3 of the tongue, it is stated that both the general sensation, the touch, and the special sensation for the taste, تذوق, supplied by the ninth cranial nerve, which is the glossopharyngeal nerve. Okay. The blood supply of the tongue is supplied by two main branches. The main source is by the lingual artery, which is a branch of the external carotid, one of the anterior branches of the external carotid, and the supporting artery from the tonsillar branch, which is a branch of a facial artery, also supplying part of the tongue, while the drainage of the tongue is by the lingual nerve, by the lingual vein, drain the blood from the tongue and then passing to its drainage. The last slide regarding the tongue is the clinical relevant conditions, and here I select a simple one for you, called a tight tongue, or tongue tie. Sometimes we call it the tongue tie. This condition can be explained by the following points. The tongue, whether it is extrinsic or intrinsic muscles, doesn't matter. It is attached to the floor of the mouth by what is called the frenulum, and the frenulum is a fold of mucosa and connective tissue attaching the tongue, or the inferior aspect of the tongue, to the base of the mouth. And this frenulum normally does not limitate the movement of the tongue. The tongue can protrude anteriorly, or retracted, or even elevated to the tongue, to the roof of the tongue, of the mouth. It does not affect the movement of or the mobility of the tongue. But if the frenulum is enlarged, or even it is a big one, this might cause some limitation to the mobility or the movement of the tongue. And in this condition, we will have some limitation or restrictions of the movement of the tongue, and the condition is called a tongue tie. Sometimes when we ask the child to protrude his tongue we can see the tightness of the tongue and cannot be protruded more outside the oral cavity, and sometimes can be bifid by the tethering by the frenulum attaching to the base of the oral cavity. The tongue will be evident as bifurcated or bifid into two main parts by this tension of frenulum on the tip of the tongue. This condition may cause some difficulties in the breastfeeding during childhood or even infancy, and sometimes might affect the way of speech of the children. And this can be managed by simple surgery. Just we ligate the frenulum, and we can cut it through to let the tongue more free. I think this is the important points regarding the anatomy of the oral cavity and its contents in a simplified way. Thanks and goodbye.